Well, moving on now, let's focus on the big story at this hour. The government-appointed scientific panel has come up with a report now on India's COVID status and future projections. It's some sort of a prognosis in a way of the given situation, which also would serve as an important document to further strategize and to formulate policies for the government as a study of the current trends and patterns with the given numbers. Now, what has happened with this report is that it has come up with some very startling findings, at least 10 important findings, and we are going to take up some of the concerns related to these findings in today's broadcast. The COVID-19 epidemic, in fact, may have peaked sometime in the middle of September, as per this report, when the active cases touched 10.7 lakh. According to the key findings of this committee, now by February 2021, the total number of people who have been infected with the virus at some point would not exceed 106 lakh. That is 1 crore 6 lakh. Now, this number is again critical and important to understand because it somehow talks about a certain consolidation of the numbers with no further increase of new cases. Now, viewers might recall that already the daily load of cases have started coming down in India, and which is why speculations are rife that we have crossed the peak and we are now in the process at least of flattening the curve. So those are some important questions that I want to raise with my guest this afternoon. Mr. Manindra Agarwal is a professor at the IIT Kanpur and also member of the Supermodel Committee. Good afternoon, Mr. Agarwal. Appreciate your joining us here on Mirror Now this afternoon, and we all of course waiting to hear your inputs on this very important sort of report that has come out now, Mr. Agarwal. Two very significant things it says. The figures, let's first just dive straight into that. 105 lakh projected cases by February 2021. And it also says that 30% people have attained herd immunity. I want to know from you as a member of the Supermodel Committee, how exactly were these figures worked out and arrived at?
So, thank you. First of all, I just want to clarify one very important distinction that has to be kept in mind. When we say that 105 lakh cumulative infections by February, what we mean is that these are the ones that are in some way symptomatic and get recorded in the usual databases. But with COVID-19, we have a very large number of asymptomatic patients who do not even get detected. And so when we say 30% of the current population, according to our model, has already developed antibodies, nearly all of them are the ones who were infected at some point in time, but they were asymptomatic, so they were never detected, and now they are recovered and have antibodies. So the model that we developed towards this is based on a set of 7 differential equations, as we call it in mathematics. It's a standard way of modeling the dynamics of any pandemic. And what we brought in additionally into this was a novel way of measuring the asymptomatic cases who are, as I said, never detected. So on the face of it, it's hard to even estimate what that number out there is. But we could find a way to indirectly measure that number, and that's what has led to all this development. So I hope that
clarifies. So important thing what you've just said is that this is a standard way of... Okay, go ahead, please.
I was just saying that this is basically we've taken a standard model for modeling pandemics and brought in our own innovations in that, keeping COVID-19 properties in mind, and that seems to be giving good results, and that is what we have used.
Right, but then there are concerns, Mr. Agarwal, that, this is a country with ever-evolving situations. There are festivals now round the corner. And if you look at the Kerala model, this is precisely how it worked out. And it appeared as if things are quite under control. And then there were all these variable factors of people coming back from the Arab countries, and things went spiraling out of control. And therefore, perhaps we also, like you very rightly said, that this is a standard way of modeling the dynamics of any pandemic. Would it be appropriate to say that this is perhaps a mathematical model and the rest of it, the factors that will have to be taken into account remain, and those will come into play in due course. For instance, if I can just draw your attention to the Union Health Minister's statement, where he also talks about the fact that there is community transmission that has started, and he refers to West Bengal. The Niti Aayog, sir, has also warned that yes, it's true that new cases and deaths may have declined in the last 3 weeks, but 90% of the people are still susceptible to novel coronavirus. So when we compare one government report with another, how do we reconcile these things?
Yeah, so firstly, there is not a lot of difference between what they said and what we are saying. We are also saying that if we follow the current protocols for personal safety, social distancing, hygiene, then by February end, we should expect a reduction in the level of the pandemic. And that if is a very big if, and as you very rightly pointed out, with festivals coming in, and the tendency of people to congregate in large numbers, this estimation that model says is only, as I said, based on assuming certain behavior or certain level of protection amongst people. But if that is no longer valid, then the prediction from the model are also not valid. In fact, we did a simulation in the model by removing all protection measures. What came out was somewhat startling, that within a month of removing those measures, the number of infections will top 25 lakhs. And right now we are at about 7.5 lakhs. It will very rapidly rise to 25 lakhs. So that is the lesson, that if we, as at a personal level, if we continue following safety measures, we will be in a reasonably good shape in the future. But if we do not follow, then there will be definitely consequences which will be unpleasant. So in that sense, the future is really in our hands. We will decide how the future unfolds.
Yes, so if I understand you correctly, this report is based on the study of factors and trends so far in the period that ensued so far. Based on that, these are the figures that we have, and therefore you're insisting that all those measures should remain in place and there should not be other unpredicted, predicted factors suddenly coming into play. All those things are not there. But I want to understand again from you that the very important point that this report talks about is how the lockdown has been effective, and the government is in a self-congratulatory mode right now, talking about how the lockdown was imposed just at the right time to restrict the cases by October, like we have seen. How did you assess that part?
Yeah, it is very simple. See, once we set up the model, there are certain parameters of the model that we estimated from the data prior to lockdown and from the data post-lockdown. There was a significant change in the values of some of those parameters. So when we said that, okay, let's forget about post-lockdown period, let's retain the values of those parameters which were prior to lockdown and see what happens. And we found that if there was no lockdown, then the number of infections would have touched almost 1.5 crores by June. And there would have been more than 25 lakhs of deaths, which is rather staggering numbers. And it was quite a bit of a surprise to see for the committee also that this is what. But on the other hand, you do see in European countries which did not impose lockdowns, they did end up a very rapid increase in the infection. So in that sense, it is understandable why the way it is coming in.
Okay. Right. But has the panel factored in the possibility of a second wave? I also want to know that, at this stage, to what extent would it be prudent to come up with a figure without a vaccine being formally announced? Have you factored in the coming in or announcement of a vaccine as well when you come up with the predictions for February?
Not really. See, this is a mathematical model. So until there is data to support the model, we really don't want to venture too much into speculation. none of us knows exactly when the vaccine will start to be available to a large population of the country. Also, what exactly would be its effectiveness. So until those things are clear, it doesn't make sense to factor it into the model. You talked about the second wave. We did analyze the possibilities of that. One way the second wave would come, which is what happening in some European countries right now, is when, as I said just now, that if people relax too much and stop following safety protocols, then there will be a second wave. And as I said, within a month, the numbers will shoot up rapidly. That particular wave is will be rather is a function of the behavioral patterns of the population. Then there is another kind of second wave, which is bound to be there, which is when the those who get infected and recover, they develop antibodies in their system. So that makes them immune to reinfection. But those antibodies may not last forever. And that is a question that nobody really has an answer as of now, that how long do these antibodies last? But assuming that those antibodies do wear out after some time, then those who were not susceptible will again become susceptible for reinfection. So the entire population will slowly move back to the original place where there was everybody susceptible for reinfection, and then the numbers will rise again, which is the second wave. So the second wave of that kind will certainly arise, provided we do not get vaccine by then. If we do get a good vaccine by then perhaps we can control it.
Okay. And about the future lockdowns, Professor Agarwal, what is your take? Because clearly in this report, the report seems to suggest that there would be no need for future lockdown.
Yes.
And another point which is significant is that it says that there is no sharp rise in cases because of migrant movement. Now, I want to understand from you how this conclusion was arrived at, because there's it's widely known that there isn't enough testing happening in the rural areas. On what basis did the panel come to this kind of a finding that there's no sharp rise because of the migrant movement anyway?
Okay, so I would answer both the questions. First one is the future lockdowns. When we did the simulation that suppose all the restrictions are lifted off, then what happens? Then we also did simultaneously simulations of what if we increase the restrictions, namely we add some lockdowns. It turned out that by increasing the restrictions, the pandemic trajectory more or less remains the same. So as it would if we continue with the current positions. So that suggested that the additional lockdowns are not necessary anymore. They were useful earlier, but not now. And that is why the committee has suggested that large level lockdowns, district level or state level, are not desirable now. Only when in very small region, let's say community level, there is a very wide, rapid spread, perhaps there is lockdown locally can be imposed for some time to control that. Now, regarding the migrant labor, there is the novelty of our model, which we had introduced, is the following. We specifically account for the fact that there is a large number of infected people who are not reported or even tested, and therefore they remain undetected. And we have found a way in the model to measure that number also indirectly. Not directly because they are not reported, but there is an indirect influence they cause on the growth of the pandemic, or the reportage of the tested cases. So armed with that, what we did was we applied the model on the data of Uttar Pradesh and Bihar during this migration period of May and June this year. And we found that the prediction from the model shows that there is no significant rise in the unreported cases. And that is what led the committee to conclude that this migration did not result in a very significant peak
Right. All right. Professor Manindra Agarwal, thanks very much for joining us with your views on how this panel took various factors into consideration. This was a national level supermodel that was based on various parameters, which has reflected on the timing of the lockdown, impact of the lockdown, and also given us a future course of the pandemic. I appreciate your joining us and giving us your valuable inputs and sharing with us a clear understanding of the workings of this panel and an understanding of the findings as well. Thanks for joining us.